you assume that emergency is where people fall off ladders or get in car accidents and have these big emergencies, when in actual fact, the majority of the patients I saw, an acute exacerbation, so a sort of short-term blip in their long-term health condition. So these are people with long-term lung conditions, long-term heart or diabetes, or, all these chronic illnesses that, if not well managed, then have complications. And that's when we see them in emergency. Basically, everyone that I saw in emergency would benefit from have moving more beforehand. And actually, a lot of the time, I'll try and counsel them about physical activity. And just as examples, we've got elderly people that come in because they've had a fall. If they can move more, then they get better balance, coordination, better strength, so that if they do fall over, they can get themselves back up. People with dementia or cognitive decline, that's reduced by exercise. You've got people with diabetes. We know how well exercise can treat diabetes. And so when they come in with problems with their nerves or heart conditions or just trouble with their sugar management, again, exercise can manage that.
Hi Ash, thank you so much for coming on the podcast today. I have heard lots about you and seen your face popping up for a long time on social media on the Central Coast, but I've never had the privilege of meeting you face to face, so it's lovely to meet you.
Yes, that's it. It's lovely. Thanks for having me on. This is exciting.
No problem at all. So what I'd love you to do is just to tell the listeners a little bit about yourself and how you've ended up where you are today.
Sure thing. So my name's Ash. I have worked in emergency for the last sort of 5 years since I moved to Australia. But my passion, which sort of came about before I even moved to Australia, is about physical activity promotion, the benefits of exercise on health. And so that's really driven me to get connected with exercise specialists and physical activity providers on the Central Coast and adopt this name of Dr. Do More. And yeah, so I sort of spend half my time as a doctor and then the other half trying to think of ways and initiatives to get people more active.
Amazing. And so do you come at that as someone who's been very sporty or into exercise your whole life?
Yeah, definitely. And I see that as a real privilege. I grew up, thankfully, with parents that saw the value in being active and sporty. I was never actually that good at sport. So my dad coached football, or soccer, as people call it in Australia. And I wasn't very good at that. And so I found basketball and then sort of just drifted more into fitness-based things. So I did a bit of kickboxing, more for the fitness. Then I got into going to the gym, and now I've moved more into CrossFit, which again is just sort of general fitness. But yeah, I've definitely always been sporty, grown up with very active parents, luckily.
Amazing. And so tell me a little bit about what message that you would love to get across to people about exercise and wellness.
Sure. The two key messages when I think about how people can benefit from movement and how that impacts their health. One is, you don't have to be an elite athlete. I think a lot of people think we have to do so much, and we create this massive step in our mind, or this outcome, this end goal, that we have to get to marathon running status, when in actual fact, the biggest impact on our health will just be doing a little bit more. So whatever that step you've created in your mind, make it small, the smallest step you can, and just start moving a little bit more. That's point number one. And then I think point number two is that it doesn't really matter what you do. When we talk about exercise, a lot of people think we mean running or the gym, when in actual fact, all the research shows that it's moving. And that can be however you enjoy it. And if actually you have a preference for something, then you're far more likely to do that than if you tell yourself you have to be a runner or you have to go to a gym that you don't want to.
And you've obviously worked in emergency in Australia for quite a few years. Can you think of any examples of patients that you would see in emergency that you wish that you'd been able to get your hands on a little bit earlier?
All the time. And I think whenever I talk to people about emergency, and I did this before I worked there, you assume that emergency is where people fall off ladders or get in car accidents and have these big emergencies, when in actual fact, the majority of the patients I saw had an acute exacerbation, so a sort of short-term blip in their long-term health condition. So these are people with long-term lung conditions, long-term heart or diabetes, or all these chronic illnesses that, if not well managed, then have complications, and that's when we see them in emergency. So basically everyone that I saw in emergency would benefit from have moving more beforehand. And actually, a lot of the time, I'll try and counsel them about physical activity. And just as examples, we've got elderly people that come in because they've had a fall. If they can move more, then they get better balance, coordination, better strength, so that if they do fall over, they can get themselves back up. There's, again, talking about older populations, people with dementia or cognitive decline, that's reduced by exercise. And then you've got people with diabetes. We know how well exercise can treat diabetes. And so when they come in with problems with their nerves or heart conditions or just trouble with their sugar management, again, exercise can manage that, just to list a few things. So yeah, basically everyone I'd see, I'd be like, which I think is what's driven me into moving into GP, or moving into remote and rural medicine, because I didn't feel like I could do enough of this preventative medicine in emergency exclusively.
Yeah, amazing. So obviously, as a GP, you're at that forefront where you're able to hopefully coach people to make these lifestyle changes. And I'm sort of at the slightly other end of career than you, in that I've been a GP for 20 years, but I too, like 4 or 5 years ago, I did my American exams in lifestyle medicine because I wanted to see I'm very into what does the evidence say, but I wanted to understand, like, what does the evidence say about walking? What does the evidence say about meditation? What does the evidence say about yoga? What does the evidence say about diet? And it's just so interesting of how many health conditions actually have fantastic evidence for if you just can change some of the lifestyle things. But the other side of it is it's really hard sometimes, even myself, to feel motivated to do these things. Do you have any thoughts or any little tips that you would have for people to try and get themselves motivated to make these changes? Because we live in an environment where it's pretty easy to be a bit lazy and sedentary, and to make really sort of easy choices with food. And it's actually much harder to make the healthier choices.
Of course, and that therein lies a big issue. And I think, especially when it comes to diet, it's so easy to overconsume calories, and reach for what we label as junk food and things like that. So when it comes to movement, I think that the two key points I talk to patients about, or friends and family, is there's often a lot of guilt and shame that we feel when we're talking to ourselves, our internal monologue about our lifestyle, whether it's smoking, diet, or exercise. But focusing on exercise, a lot of people have this, you should be doing something, or you start to beat yourself up if you're not moving enough. And as someone that loves evidence bases, that research shows that shame isn't a good motivator. Actually, being compassionate to ourselves and the people in front of us is far more likely to motivate you to make that lifestyle change. And so the way I get around that is to, one, validate that we all feel like we should be moving more, or that we should be fitter, or whatever it is. And that's okay to feel that way. And what can we now do to start really small? What really small, attainable change can we make? Because if we can do that, even if it's just once a week for a few weeks, we can then tell ourselves, well done, we made a change. And that's more than we did before. And then if the next week after that, or even the next month after that, we increase our physical activity by even 10 minutes, like, I'm thinking, make that step so small that you can do it. And then that will just start compounding. There's no point. We often see, especially with diets, you go from whatever your normal diet to eating 1,000 calories a day for a week. Sure, that might help, but you won't keep that up. And it's the same with if you suddenly go from barely moving to going to the gym 6 times a week. You're going to be really sore. Other parts of your lifestyle are going to take a hit. Whereas actually just small, attainable things that you can then feel proud of will start to add up.
Yeah, I agree. I think sometimes people create goals or challenges for themselves that are way too big. I had a patient really in the last week or so who wants me to help support her with some weight loss. And whenever we talked
Hmm.
about setting a goal, her goal was like she wanted to lose 45 kilos. And
Yeah.
I was kind of like, okay, well, that's great, but the reality is that that's just way too big a target. Like,
Hmm.
let's break this down into smaller bite-sized chunks. And
Yeah.
you're absolutely right. I've even had this myself where you go fast and hard at the gym and then you can barely walk for 5 days and then you think, oh, this is all too hard and too painful.
Yeah. Yeah. And you beat yourself up again, and you think, and this is where I think technology and social media comes into play, doesn't it? There's so many influencers or so on that look amazing, and they might even show you some sort of body transformation that happened really quickly. But for the average person, these things, these lifestyle changes take a lot of time. But for some reason, we're not letting ourselves sort of appreciate that. We beat ourselves up that it isn't happening overnight. I think I saw a really interesting picture the other day where it showed um, a sort of a healthy weight and just gradually getting overweight, and it underneath it, it sort of said 10 years, and it had progression 10 years, and then it had our expectation beneath it, and it was from that unhealthy weight to a healthy weight in like 3 weeks.
Yeah, that's
And
right.
so for some reason we don't appreciate that it took a while to get there, but for some reason we want to reverse it within a week.
Yeah, absolutely. I agree. I think the other thing, as you said, I think there is definitely a lot of guilt and shame. And I know that I certainly even feel that myself. And patients
Mm.
say it to me a lot. I know what I'm supposed to be doing. I know what I'm supposed to be eating. I know I'm meant to be doing more. But, everyone just seems to be super busy. And obviously, an age group that I work a lot with are sort of women sort of 30 to 55, and they tend to be the person who's juggling all the home stuff and
Yeah.
school and appointments for everybody and going to work, and actually finding the time to prioritize themselves is actually a real challenge. Do you have
Mm.
any like little tips or tricks to get those people just to come up with an idea of how they might be able to put some exercise into their day?
Yeah, I think you hit the nail on the head by mentioning prioritization. And that can be really tough because a lot of the patients I'm now seeing as a GP, they're prioritizing their partner or their children, and therefore not then finding that they have the energy or whatever it is, or the time to then exercise or even go for a walk around the block. My, again, without adding too much guilt, my tack with that is to sort of talk about the long term implications and actually say that in the long term, by prioritizing yourself, you're going to have better health, which means that you're going to be better able to support your family, or whoever it is that they're sort of prioritizing currently. And that can be a bit of a wake up call. Sometimes it can be a bit of a hard truth to hear. But I think for certain patient groups, they kind of need um, that sort of tough talk where you say you think you're prioritizing other people, but actually you need to look after yourself first. And there's loads of different metaphors and those sort of things platitudes where you can say you've got to fill your own cup first. And I think that's the same with our mental health, our physical health, our financial health. There's no point trying to help other people if we don't support ourselves first.
Yeah, so obviously I know that you are love the evidence base, and I think more and more people are have so much more information at their fingertips. Is there any pieces of research or things that you think might motivate people to move more? I mean, obviously we can say, "Oh, you'll be healthier when you are older," but is there any sort of more hard and fast facts that you could share with us?
The the punchiest one that I remember reading ages ago, and I've seen lots of different figures, so I just sort of quote the ballpark figure, but is around all cause mortality. So that you'll know that means, but for sort of the average listener, that's our risk of dying from anything. And so um, the I think the first thing I'd read that if we bring our physical activity levels up to the minimum guidelines, so the WHO guidelines, we can reduce our all-cause mortality by up to 30%. And that blew my mind because there's no pill that you could find on earth that would have that great a health impact. Yet everyone's looking for shortcuts and quick fix pills or to start supplements or something. And the majority of the patients, I'm sure you see as well, but the majority of patients I'm seeing are on blood pressure medications, diabetic medications, all these things. Yet physical activity can reduce your risk of dying from anything by up to 30%. I found that insane.
Yeah, it is. It's absolutely amazing. Another study I heard about recently was that they took, so your hippocampus, which for everyone listening is a part of your brain, and that sort of shrinks as you age every year. I think average 1% per year. And then they took two groups of people and they got one of them to do like a short burst of walking. I think it was 5 or 10 minutes per day. And then they got the other, well, I think they had three groups, but one of the groups, they just got to do some stretching. And then another group, they got to do nothing. And so you're expecting, obviously, the size of the hippocampus to shrink as you age. And it does have lots of implications for memory and functioning and spatial awareness. Mm-hmm. And the group who just did the 5 to 10 minutes of burst of fast walking once a day, actually their hippocampus grew in size by 2% in just a year. And I thought that was actually amazing. So I think, we often think about exercise as being about muscles or muscle tone or weight or healthy weight. But actually, I think what has become really to the forefront is how much exercise actually impacts your brain. And I think for a lot of people, there's a real fear of memory loss or, losing that kind of function from their brain. So I often wonder if we didn't get some more of that information out, that it actually probably the organ that benefits equally to your muscles is maybe your brain.
Oh, I 100% agree. And I think that's the area of medicine that I found people relate to the most. I used to joke about it until someone said that, well, I'll tell you what I used to joke about is that no one would get out of bed in the morning and exercise to reduce their risk of diabetes. And then I met someone that said, no, that's why I exercise actually. So there's always an exception. But the majority of people don't exercise because they want to reduce their long-term cardiovascular risk or, those health metrics that we know it impacts. Whereas the majority of people want to exercise more because they feel better or they have more energy that then confers into how they are with their family or their partners. There's that mental health aspect and well-being is such a crucial part where I think the evidence is now growing and we're seeing much more data about its impact on depression, anxiety, just average sort of long-term wellness, its impact on pain. We know that exercise reduces our perception of pain and even just our quality of life. There's studies that look at just quality of life. And I think those are the metrics that people are going to relate to a lot more than if you say, oh, it will reduce your risk of atherosclerosis or cardiovascular disease.
Yeah, I agree. And I think the other thing is that whenever you are someone who is young and in your youthful period and feeling in good health, it's very hard to visualize yourself in the future. So
Yes.
I think just being able to understand that actually you're just putting these really good building blocks for the future. What does the evidence say for someone who maybe is 50, 60, who hasn't done a lot of exercise until this point? Is there any evidence to say that it's worthwhile, or is it just too late?
It's definitely worthwhile, just to put that there right away. The best analogy I feel with exercise as we get older, for me, is similar to like our financial health, where we will meet a lot of people, and actually it's something that we probably don't discuss that often. But there may be someone that you see that's 50 and they're looking at a life ahead of them of just working, and they've never been fantastic with how they save money or putting money aside or whatever it is. And the advice to them is it's never too late to start saving and to think about your sort of financial future. And that's the exact same message for our health. The impact you can have now, actually, you may not think it's the case because you've got the majority of your life behind you, maybe, but actually by getting slightly more muscle mass on you, you greatly reduce your risk of falls. You're going to slow down or even stop your cognitive decline. I think it's the similar message to people that are still smoking into their later years. it's still worthwhile to try and stop or cut down. So, and if anything, I see the benefit of exercise in that older population so much more because they maintain their independence. And that's this thing that as soon as you start realizing that your independence disappears, you realize how much you were taking it for granted. And exercise is this fantastic way of keeping you able to look after yourself.
Yeah, absolutely. I think most people dread ending up in a nursing home and things. So it's trying to think of
Yeah.
those exercises that also improve things like balance. Like I know
Yeah.
I phoned my mum who lives in Ireland and I'm telling her that she's to stand on one leg when she's brushing her teeth.
Yeah. Yeah. Love
True.
that.
Ash, I was going to talk to you a little bit about exercise and cancer. I think a lot of people actually haven't made that connection. So I think there's obviously been a lot of publicity and advertising campaigns that have centered a lot around smoking and cancer, and then also obviously things like weight and the connection with cancer. But people haven't maybe made that connection with exercise and cancer. And I know that's something that you were very passionate about when you lived on the Central Coast. Can you tell us a little bit about that?
Yeah, definitely. So that's an area that I'm passionate. One, because I was asked to be involved in a fundraiser, and that sort of just spiraled into a whole big thing. And now I run an annual walking challenge to raise money for Cancer Council. But then also personally, my dad died from a brain tumor, um, and the link I have with that and exercise is he was given I think it was a sort of 90% 1 year prognosis. So the majority of people with the tumor that he had died within a year, and he survived for 4 years with a pretty good quality of life during that time. And he was one of the fittest people I knew. Used to run all the time, ex-military, very fit, and I looked up to him for that. And the reason I think it's actually really important, and this is something that it's kind of hard to show in the data, is that one of the reasons that he got his diagnosis and probably got it earlier than he may have done was because he was out running and was just drifting into bushes. So it was affecting his vision, or at least the vision processing center in his brain. And so while he was running, he thought he was running straight, but he was just sort of veering off to the left. And that's this idea that when we're pushing our level of function beyond just average daily tasks, we are much more aware of our body and we pick up on things when they're slightly not right. Whereas actually, if he was someone that was really sedentary, potted around the house, didn't do much, he probably wouldn't have recognized that he was slightly veering off to the left. And that could have taken months, if not even a year, to realize. And that's something that you see in fit people when they start to have a problem, like a cancerous tumor that's pressing on things. Actually, you detect it earlier. So that's a sort of more of a personal anecdote there. When it comes back to the evidence base, with so many different types of cancer, we know it has a positive impact. And I often talk to people about what's called the cancer continuum. And so from sort of early diagnosis right through to treatment, whether that's with radiotherapy, chemotherapy, surgery, and then through to ongoing treatments and remission and surveillance, we know that all the way along that spectrum, that continuum, exercise plays a really crucial role in reducing our risk of cancer, improving our chance of getting through surgeries, reduces our risk of side effects and all the different drug effects that are related to treatments. And then also our long-term remission, we know that it reduces that. So yeah, it's huge, the impact that it has on and so many different types of cancer too. But I think because there's so many different mechanisms, the evidence is a little bit far behind. We know that it reduces risks and improves outcomes, but just in a sort of broad sense.
Yeah, absolutely. And so, in terms of if you had your ideal and you could get someone to do your ideal exercise in a week, what would that look like, Ash? Let's say let's pick a couple of different groups. So let's say you have a 50-year-old female. What would your ideal be to get her to do?
See, I'd be, yeah, I mean, well, minimum, we've got the WHO guidelines, which I think are a good minimum target. So that's 150 minutes of moderate intensity physical activity. We want to have ideally 2 strength sessions in there, which I think a lot of people overlook. And then something also in there affecting our balance and coordination. So when we put that into context, my minimum, let's aim for a bit more than that. I would love to see someone doing probably 3 sessions that are more the what we see as a sort of cardio, and they could be 30 to 45 minutes, and that could be cycling, that could be brisk walking. If they enjoy running, that could be running, or if there's someone that likes going to a studio or a gym, they could do something that's a bit more sort of continuous movement rather than strength session or resistance stuff. I'd have probably those 3 sessions, and then 2 sessions strength based. Um, Again, what they want to do would be up to them, but the gym's a very easy place to direct people to. I just think not, it's this very mainstream thing that I don't actually think fits the mainstream. So on the Central Coast, there's loads of more sort of boutique gyms and places that would be more tailored to someone. So for this 50-year-old woman, that might be, I know there's Active Nation, which is a female-only gym in Erina. There's lots of gyms that would be much more sort of welcoming to an individual than your sort of mainstream, in you come, here's a template workout. And then I'd also want 1 extra session in there. We're probably already hitting the minimum requirements, but I'd want 1 extra session that was just more like play. I think yeah, fun. And really, that's the goal. The goal is to go in, and whether it's fun because it's sociable or whether it's fun because the movement itself is creative, I think trying to find that in exercise again is a really nice way for people to go, oh, I really enjoy moving and I enjoy that my body can move. I get that from doing CrossFit and doing silly things in a CrossFit gym, but I know that there's acrobatic things, there's dance classes, or even if it's a walking group where you just really enjoy the people you're out with, walking and talking, then I think having at least 1 session a week where you're there not because you're trying to get your heart rate up or you're trying to work certain muscles, you're there because you can enjoy it.
Yeah, absolutely. And Pilates seems to be massively popular as well, like huge on the Central Coast.
Yes, yeah, and I kept on telling myself I'd include it more. I'm yet to find a place down here in Wagga, but it's so good for you. And I think the way that you learn more sort of control of your body through movements. Again, it's really easy to go into a gym and know that I'm supposed to do a bicep curl or I'm supposed to do something, and you sort of throw your body around. Whereas it's very humbling doing Pilates and then just, even just doing a leg raise out to the back and going, "Oh, I'm finding this quite challenging actually," and reducing weights or not having any weight at all.
Yeah, absolutely. And the other people who often ask me how much they can exercise are pregnant women. Is there like any rules around how much exercise you're meant to do then?
Yeah, so there's a lot of myths and misinformation around exercise and pregnancy, which is a real shame because it's a real crucial time where I think a lot of women's health can deteriorate because they think I'm not supposed to exercise now. When in actual fact, the guidelines are very much that if you're an active person beforehand, then you can continue exercising until far later in the pregnancy, at which point really the advice tends to be that listen to your body at that stage. If you're getting pain that's more than a sort of 4 out of 10, reduce the intensity, and it's only later in the pregnancy that you're told to sort of taper down. But at that point, I think most women are feeling, whether it's fatigue or aches and pains, that self-limit the exercise. So I think going into pregnancy thinking I can't do anything right away is a real shame, because suddenly women are going to decondition, and even things like gestational diabetes are going to be more prevalent because exercise helps our sugar control.
Yeah, absolutely. Another group of people who I see a lot, and you'll probably start to see a lot of people with back pain, and I find that they want to sort of lie in bed, and I totally understand. I've had back pain myself, and it is
Yeah.
absolutely horrible. It's an awful type of pain. But what really should people be doing if they have acute back pain?
Yeah, I love the way that you've talked about that, because I can tell that you're not an old school doctor that uses what I call the R word, because most people have spoken to an old school doctor that told them to rest. And we know that's the worst thing, especially for low back pain. And like I say, I get it. I've had bouts of back pain where you feel like all you want to do is lie down and sleep until it goes away. But unfortunately, we know that pain, often to do with, naturally, there can be bulging discs and things like this, but often to do with muscle spasm, inflammation around the joints of the spine as well. We know that if they're just sat not moving, everything seizes up more. We get reduced blood flow and therefore reduced clearance of inflammatory markers and things like that. So movement is the key principle. And I've been taught by many physios and many more experienced doctors that the principle of managing low back pain without red flags is pain relief so that they can move. And I say to patients, I almost have the same spiel. I say, I need you to move more. I'm not expecting you to go run a marathon, but I want you to be walking around regularly. I want you to be gently active so that this improves gradually, and we'll get through the acute bout of back pain. And then we can start assessing what the factors are that are causing it, whether there's certain movements that are triggering it, or whether there are certain injuries that are predisposing it. But for that beginning bit, we don't rest.
Yeah, I agree 100%. I think my nightmare when people tell me they've been in bed for 3 days with their
Yeah, yeah,
back, and I'm like, oh no, this is an
yeah.
absolute nightmare. It just made the whole
Yes.
thing worse. In terms of chronic pain or people with chronic conditions, so one of the groups that I see quite a lot are people with chronic lung disease, and they're one of the groups I'd love to exercise a bit more, but I also understand they're very fearful. When they have a chest infection, they know what that feeling is like, to not feel like they can get enough air, and they're pretty scared of exercising. But there's good evidence again for them to be in a exercise program, isn't there?
Definitely, and you're right. I think acknowledging the fear, and it really is. I mean, I don't know if you've been in a situation. I've in years past had panic attacks, and you have this shortness of breath, and with that comes this genuine sense of like impending doom. Um, and so add in a lung condition that makes you short of breath, even with short normal bouts of exercise, then naturally people are going to think, hold on, if I move more, I'm going to be more short of breath, and that's a problem. And so I think acknowledging and validating that feeling that yes, it's scary, but we do know it's good. One way I talk to patients is about their sort of functional capacity, and that if we let ourselves be limited by how short of breath we are, then our world just gets smaller and smaller until we're going to be short of breath standing up from the chair moving 5 meters. And we've both seen patients like that unfortunately are short of breath with over short distances. So we want to talk about really gradually improving that tolerance, that exercise tolerance. And with that, I found the best way to talk to patients is again about reducing their expectations. So we're not going to go from, your walk around the block where you get out of breath to suddenly doing a 5K run. We're going to be doing, okay, well, let's add 10 meters, or, let's, for a period of 10 meters, increase the pace and then come back down to where you're comfortable again, and then do that for a few times. So just really small steps to increase. But I often find with patients that do have these chronic lung conditions, that's where I'd be referring to an exercise physiologist, because they're so good. Yeah, they're fantastic, and they're able to provide that sort of clinical safety as well. That I think a lot of patients, they almost need someone there so that when they get short of breath, they can check and go, "Am I okay? Like, is this all right?"
Yeah, I find the same. And I find the same as people after cardiac events. There's there's that massive loss of confidence, and people
Yeah.
are afraid to exercise, and they're actually afraid to have sex or be intimate with their partner because they're really scared that actually they're going to trigger some kind of further cardiac event. And sometimes it's talked about really well in the hospital setting, and then sometimes people slip through the net and the conversations aren't had, and it can be a few months down the line when I realize that actually this person is literally terrified that they're going to have
Yeah. Yeah.
another angina attack or a heart attack or whatever. And you know, I think that it would be just so much better if we had more money, I suppose, invested into these rehab services after these situations. But I think
Yeah.
sometimes patients also aren't super keen on going. They're like, "Oh, I don't really need to go to that. I know what to do." But actually, just
Yeah.
someone to have those very frank conversations and you know, answer the hard questions or the embarrassing questions.
Yeah, definitely. And you see it in loads of different scenarios where, so for instance, someone that's come out of having cardiac surgery, whether they've had bypass surgery or something, and then they have their prescribed cardiac rehab, and then there's nothing. And you kind of want this to bridge each gap. And it's the same with people that might see an exercise physiologist for a short period of time, or even a physiotherapist after an injury for a period of time. They then sort of get the sign off tick, and then there's nothing. And lots of people are, oh, I'm fine, I don't need that. And you're like, well, you may not need that, but you're back to here now, and we want you to be a bit higher up. So, and that's where it's really difficult. And even with sort of the non-comorbid population, people with no health conditions at all, there's not much for them. I find myself recommending exercise physiologists for far more people than they probably have capacity for, because between them and nothing, we've got a whole array of personal trainers, some of who are fantastic, but some unfortunately don't sort of understand how individualized it needs to be.
Yeah, absolutely. And I think if you're someone who's just been in hospital with something pretty serious, you're also not going to be particularly suitable to just go and join the local gym and, you know,
Wow.
work your way around the apparatus. That's too intimidating and too scary,
Yeah.
really.
Yeah, of course. And a lot of gyms, and I understand they've got to sort of protect themselves, but a lot of them will have that standard questionnaire, which as soon as you tick a box that says you have a health condition, they sort of go, oh, well, you got to go get signed off. And so, yeah, when I was on the Central Coast, especially, and I plan to do it again down here, I was kind of trying to talk to gym owners to empower them to have a bit more confidence, or at least talk to someone like myself, so that when that person with asthma comes along, they don't just go, nope, can't have you here unless you've got a sign off. They can maybe problem solve, talk to them, or reach out to an exercise physiologist or someone, so that they can actually help more patients or people.
Yeah, absolutely. Because it's such a barrier. There's no doubt that some people will make the appointment and come to their GP to have that form signed. But for some people, that it's just too hard. They've kind of finally plucked up the courage, go to the gym, kind of get rejected,
Yeah.
and they're like, oh, I'm too embarrassed. I'm not going back.
Yeah, definitely. Yeah, the fewer barriers we can create, the better.
One of the things when I was a GP trainee 20 years ago back in Northern Ireland, which was quite sort of innovative at that time, it was really big in Scotland. They used to do this prescription of exercise, and a few of the local government organisations let GPs prescribe exercise programs, but they were all in nature. So they were like in local forest parks and things like that. And it was probably quite innovative for 20 years ago, but it's interesting how it hasn't really progressed. Like, we do talk still about, you know, GPs prescribing exercise, but I have to say that whenever you've got that busy consultation and there's so many things to go over, to be honest, it's like, oh, by the way,
Yes, yeah, yeah.
it's definitely a challenge, isn't it?
Yeah, it is. And I recently went to a conference where this was the whole talk, essentially, the whole day of lectures about how we can find ways in the busy GP life to prescribe exercise. And I still roll my eyes whenever I see a headline that's, these new GPs that are prescribing exercise, because I'm thinking, we this isn't new. We know how good it is. If anything, if you're not prescribing exercise, you should be in the news for being GP isn't prescribing exercise. Someone should talk to APRA about them. Um, but that's just, I guess, how things slowly filter into the general population. But I think there's loads of different angles at this, but one thing is trying to find ways to counsel patients, or even just to identify those that are at higher risk of moving less when they see a healthcare provider. And so, that waiting period that a lot of patients have when they're waiting for their GP and they're sat in the clinic could be a time to fill out a questionnaire, which is something that a lot of people do, whether it's updating their address and personal information. But we can have simple questions on there about what movement do they do, how often are they moving, so that if they then come into my consultation room, I go, oh wow, this person's really not moving much. They're going to benefit far more from some exercise counseling. Whereas if they tick all the boxes and say I'm a triathlete, then I'm not going to go, oh, we need to talk about exercise. And that would be a simple way in your busy schedule to think, this is someone that's going to really benefit, and I should take a few minutes, rather than trying to broach it with everyone.
Yeah, that's great. Yeah, absolutely. So another group that I work really closely is with perimenopause, menopausal women, and that's definitely having, thankfully, a bit of a moment at the moment where lots of people are talking about it, and we are realizing through obviously lots of quite new research about this sort of dramatic loss of muscle women muscle bulk that women get in that period, and how it impacts their then future risks of disease and falls. And I would love to know your take on that, and thoughts on, a lot of people in my age group haven't particularly lifted weights, or strength training does feel maybe a little bit daunting, or they might feel like they don't want to end up with really big muscly arms or whatever. And I'd love your thoughts on that, because I do know there are so many health benefits.
Yeah, so many, and there's so many things I've heard about this, and I'm often having this conversation actually, and I think one of the big problems, I think people that are in that perimenopausal or postmenopausal period now are going to be of an age group where we had all the worst information on diet and exercise. Back when we were younger, there, Atkins diets and things like this, and it was just terrible. Whereas I think the information about how we manage our weight and how we move nowadays is a lot better. And so we're trying to unpick that, what everyone was seeing in beauty magazines all the time. And so a lot of the conversations I'm having are actually unpicking that and their understanding of what exercise is, to then re-deliver the message. And so the main thing that I find in people when I talk about exercise is I haven't mentioned weight, but I'll start talking about exercise, and they then say, yes, I've been trying to lose weight. And I then go, I've not mentioned weight loss. We're talking about movement, and actually exercise is a tool to help manage our weight, but we know that exercise isn't actually very good at helping us, at making us lose weight. That comes down to our diet side of things. Whereas all the benefits, as we've already talked about when it comes to exercise, are huge. The mental health benefits, the functional benefits. So I have to straight away start by saying, we're not talking about weight loss. We're talking about exercise. And then there's the silly thing of, oh, but I don't want to get too bulky, and how that building muscle is very much seen as the male dominated thing when it comes to exercise, and that women, they exercise to be skinny, which is, again, nowadays the younger generations, they're not seeing that. You're seeing a lot more female athletes that have these muscular physiques, and people are sort of holding them up irrespective of gender, saying you can just be healthy, toned, muscular, whatever. But again, trying to unpick that and say that actually this muscle isn't so that you get on stage and flex your muscles. It's so that if you fall over, you can stand back up again, or that if you were sat down, you're going to have less knee pain when you stand back up. And whenever people say, I don't want to get too bulky, my response is always, I've been trying to get bulky and I'm not managing it. So I don't think you'll do it accidentally. Yeah, exactly. I don't think you're going to do it accidentally. I've been trying and I'm not managing.
That's
Yeah.
so true. But yeah, I think in society, exercise and weight loss have just become so entwined in so many people's
Yeah.
minds that you're absolutely right. It is literally an unpicking, and it's also trying to get people to understand that this is not a blame situation. Like the life that how it's evolved, we have evolved into such a sedentary lifestyle. We sit on comfy seats. We
Yeah.
don't crouch on the floor and cook and things like that. And, human evolutionarily speaking, like we just haven't really caught up with how much things have changed for us. And we now have these much weaker backs. I also heard this crazy statistic, which was that if you look at sort of more ancient humans, even the average 40-year-old ancient female was 15 to 20% stronger than an Olympic rower is today. And so it just, and so like, it's just incredible. And if you do look
Yeah.
at some of those sort of more nomadic tribes and you look at some of their elders and how fit some of those, older people are, they're still clambering over rocks and climbing up, steep inclines, whereas we would not expect someone of that age in our society to be doing those sort of things. It is quite interesting how our lifestyle has absolutely impacted on sort of the strength of our bodies, really.
Yeah, definitely. And I think technology is all about making life easier. But I do feel, at least in the last few years, that it's almost trying to build it back in. Smart watches and devices like that are becoming a bit more, they're aiding us to move more rather than building the movement out of things. There's obviously a huge way to go, and just the car in general has meant that people don't move anywhere near as much. And then anyone that's an office worker can essentially get out of bed, get in the car, sit at a desk, and then do the same in reverse. So it is really hard to sort of try and work around that and work despite that. But then every so often you see great adverts of people that are exercising so that they can do certain movements. And I think there was a really cute Christmas advert of the guy that was training with a kettlebell, an older man that kept on lifting up a kettlebell, and then he'd substitute it for a heavier one. And then it came Christmas Day and he lifted up his granddaughter so that she could put the star on top of the tree. And you think this is why we need to look after ourselves, so that we can move well and we can have that functionality.
Yeah, amazing. Well, look, I only have a couple more questions for you. You'd be glad to know.
Cool.
I would love to think of something. So, obviously, as GPs, we've got really quite sedentary jobs, but we do hop up and down every 15 minutes, I don't know, to walk to the waiting
Yeah.
room and bring the person
Yeah.
back. So, that little burst of energy apparently is good, that we're
Yeah.
not sitting there for 2 hours and not moving. But what about, lots of people are office based or they work from home and they're sitting at their computer all the time and they've got their earbuds in? What kind of things could they do? What could we encourage them to do during their work day that would make a health benefit?
I think taking any meeting that you can have mobile is one of the best things to do. Um, and I think the recent pandemic and managing to work through that remotely has meant that actually loads of people are now having remote calls like us now. Like, we're doing this remotely, and if it's a work call, you can put your headphones on and you can walk. And small changes like that can become habits really quickly. One thing that I'm trying to get implemented at my practice is I'd really like a standing desk, because I think that would be far better for me. And I ask all the reception staff to ask the patients to wait as far away from me as possible. And every so often that doesn't happen, and that someone thinks they're being helpful, and I'll come out of my room wanting to take my little stroll down the corridor to call for the patient, and they're actually right outside, and I sort of go, back in we go. Um, again, like with all of my advice, I think it's these small changes. Not suddenly saying everyone should run to work and run home from work. No one's going to achieve that. But making small changes then every so often allowing for a walk at a lunch break or something like that will still have a massive effect.
You're obviously really enthusiastic about getting people moving, and I'm sure at times you can perhaps be a little bit discouraged, and sometimes then you get encouraged by the response you get. How do you keep going?
On the whole, most people are pretty enthusiastic and pretty encouraging. But even I still meet doctors that will just mention how little they think physical activity plays a role in health. And I'm thinking, these are the healthcare professionals that people rely on, and they're giving inaccurate evidence based advice. And that's pretty depressing. I think the thing that probably disheartens me the most is around the sort of weight loss culture in exercise. And that was a big shock when I came to Australia. There's a lot more bodybuilders in Australia that I'd ever seen before than I had when I was in the UK. And I find that really damaging for our mental health, because it's okay if we want to lose weight. I want to be a healthy weight, and look a certain way. I think that's, again, I'm not going to add shame to how you want to look, but I think when that's the only reason that you exercise and the only reason you eat, then it becomes very damaging, and we get eating disorders and we get very unhealthy relationships with movement. And unfortunately, a lot of mainstream gyms encourage that, and bodybuilding and big mirrors for people to pose. And I just think, with everything in moderation, all of the benefits that we can get from exercise, why not be encouraging those rather than this purely superficial thing? But yeah, on the whole, everyone gets my message and is like, and a lot of people will be like, oh, it's so new and so refreshing to hear a doctor say this. And I'm like, that's nice, but also a bit sad.
A bit annoying as well.
Yeah, yeah.
So, how do you find the transition from emergency to general practice?
It's been nice. It's a little dull at times. Because I'm so early on in the training program. Although I feel relatively experienced as a doctor, the practice and my supervisors are giving me really big time allocations with each patient. So yeah, it's a bit slow at the moment. I'm sure that'll pick up, but it's been really nice to build a relationship with patients. And so the patients that I'm seeing every other week for whatever the issue is, whether it's to re-talk about blood results. And I had a patient the other day come in and say, oh, since I talked to her about protein intake and how much ideally she should take, she's been going around and telling everyone. And she was chatting with the butcher about how much protein's in different steaks and different things like this. And it was really nice to be like, oh, this is someone that's listened to my advice and is taking it on board and is trying to move more, and even going out and telling other people.
Yeah, that's awesome. That's awesome.
Yeah.
Well, I know that you're still pretty young, but I wanted to ask you, what piece of advice would you like to give your 20-something self if you could talk to him?
My 20-something self was very anxious, and all through medical school before and even afterwards for a while, I was very anxious, and that led me to have periods of being quite down and depressed as well. And a pivotal moment for me, which is when I was in my first year as a doctor, was when I don't know why. I think I was going to a gym and wanted to make a change. So I spoke to a personal trainer and he wrote me a program, and we did what I recommend other people not to do, which is we went from whatever my baseline was to suddenly training 6 times a week, and I was sore all the time. But my mental health was so much better. And so I think it would be foolish of me not to want to give my younger self my own advice, which is to move more, mainly to safeguard my mental health.
Yeah, amazing. Thank you. So if our listeners would like to learn more, because I know that you've got some nice resources, how can they find those?
So I'm trying to build up all these resources on the website that I have, which at the moment is do-more.live. But they can also follow me on socials. I'm at Dr. Do More. And yeah, I'm aiming to just put out lots of educational content and resources for people around exercise and all the different aspects of health and how it plays in.
Amazing. Is there anything that we haven't talked about today that you would like to share with our listeners?
Off the top of my head, I don't think so. No, I feel like we've covered everything.
Okay, awesome. Thank you so much for your time. You've been absolutely amazing.
I regret that we haven't spoken more when I was on the Central Coast. I'll have to see you when I come back up. It's been so nice. It's so lovely talking to someone that cares about all this stuff as well.
If you enjoyed this episode, I'd really love you to leave a review or share with someone who you believe would benefit from hearing this conversation. This podcast and any information, advice, opinions, or statements within it do not constitute medical, healthcare, or other professional advice. Information is provided for educational and entertainment purposes only. If you have any health concerns, always consult your doctor.